So good evening, and I'm going to start with the pharmacology rapid revision for specific antimicrobials. So what we're going to do is we're going to talk about certain MCQs from the previously asked papers, and then after that we are going to take the salient features, जो important features हैं, then we are going to talk about them. ठीक है? So these are the few questions or few important topics I picked up from the papers before, and let's see what all important things can be discussed in this alongside. So the first one is the question which was asked recently in an exam, which is the site of action. What is the site of action? So please make sure that whenever you're reading or revising any of these antimicrobials, always go prepared with the site of action. So many a time site of action have been asked. So whether they are asked in the text form or they show you the diagram and then they ask you the site of action. So in this case, the diagrams have been shown. So what is the site of action of isoniazid in the image below? So there are four options. Option 1 hai, 2, 3 or 4. The boxes, option 1, 2, 3, 4. So what is the site of action of isoniazid in the image which has been given below? Very good, Arnav. So site of action of the isoniazid is your site number 1. So अगर इसी diagram को हम बाद में explain करके समझेंगे. Let's go to the second question and then we'll discuss about the others. Now here, which of the following statements are true? Which of the following statements here are true? First, pyrazinamide is an enzyme inducer. Rifampicin is used only in tuberculosis. Isoniazid inhibits mycolic acid synthesis. And bedaquiline inhibits mycobacterial ATP synthase. So, which of the following statements are true here? So because it is written statement, so there can be more than one true statement. So कौन से statements true है? Which are true here? Yes, 3 and 4. Very good. So it is 3 and 4. Both the statements are true here because pyrazinamide is not an enzyme inducer, and we know that even if you know one use of rifampicin apart from tuberculosis, which is in leprosy, right? So we know that it is not used only in tuberculosis. So these are the first two are the incorrect and the last two are the correct. Now let's detail mein thoda bahut let's discuss about briefly what all important points are for the anti-TB drugs. Now this one is a chart which I've taken from a book which is the first aid, ठीक है, USMLE वाला, and this is a very important, a very let's say high yielding table and important points which you should know about this. तो ये diagram जो हमने अभी किया the first question में, so first let's go. So here isoniazid is there given in the diagram which is inhibiting your mycolic acid synthesis. Then ethambutol का भी इसमें दिया हुआ है. It can be asked like now which is the second अगर option होता it would be your ethambutol which inhibits the arabinogalactin synthesis. mRNA synthesis, all the R's जितने भी हैं drugs, rifabutin, rifampicin and ठीक है and ये rifapentin जो भी R से शुरू होती हैं, they are all going to act as the mRNA synthesis inhibitor. Then it is your pyrazinamide. Now here it is written unclear mechanism, but it's written that it converts into a metabolite which is your pyrazinoic. It converts into a metabolite which is your pyrazinoic acid, and it is also involved in the, it also inhibits the mycolic acid only synthesis, cell wall mein. So that is the mechanism of pyrazinamide here. So let's here in the table, let's see what are the important points which have been asked and which you should must know. एक हमने किया for the rifampicin and like drugs, ये आपने mRNA synthesis याद रखना है इसके बारे में, that is most important. दूसरी चीज, it is hepatotoxic माइनर हेपेटोटॉक्सिसिटी है पर है, एंड दैट दिस इज एन एंजाइम इंड्यूसर, एंजाइम इंड्यूसर है, और इट शोज रेड ऑरेंज डिस्कलरेशन ऑफ द बॉडी फ्लूइड्स, ठीक है. सो इवन जैसे हम रिफैम्पिसिन के बारे में बात करते हैं, द कॉन्टैक्ट लेंसेज ऑल्सो, अगर आता है क्वेश्चन विच स्टेन्स योर कॉन्टैक्ट लेंसेज, दैट इज ऑल्सो योर रिफैम्पिसिन. So therefore, if patient is an HIV infected patient and develops an opportunistic infection, we don't prefer to use rifampicin there because it has the property of causing enzyme induction. तो वहाँ पे हम क्या replace कर सकते हैं? Rifabutin. ठीक है. So ये important चीज़ें. अभी एक और table I'll tell you where I'll tell you another the few important things again which is very important. तो अभी briefly isoniazid की हमने बात किया, inhibits the mycolic acid synthesis, that is what we've done. जो दूसरी चीज़ you should know about this is this the CADG, that it gets activated in the body first, in the cell first, and it is encoded by the gene which is CADG, because पूछा जाता है कि resistance कैसे develop होती है. Resistance to isoniazid develops when there is mutation associated with CADG. So this is another important thing that you must know about isoniazid. Then see, this is interesting. Isoniazid की representation, how do we symbolize this, is by INH. तो हम easily याद कर सकते हैं, जो N है it stands for neuropathy and H stands for hepatotoxicity. So isoniazid causes peripheral neuropathy as well as isoniazid causes hepatotoxicity. So peripheral neuropathy is more common with slow acetylators, ठीक है, and hepatotoxicity is more common with fast acetylators. ठीक है. So ये important because isoniazid undergoes acetylation. All the drugs which undergo acetylation are your ship drugs. ठीक है. उसमें जो I है it stands for isoniazid. So isoniazid undergoes acetylation. So we have population which are slow acetylators, we have population which are fast acetylators. तो दोनों में जो साइड इफेक्ट्स हैं, कौन से किस में ज़्यादा है? स्लो में न्यूरोपैथी ज़्यादा है, फास्ट में hepatotoxicity ज़्यादा है. And India में mostly we have slow acetylators, so peripheral neuropathy is more common Indian population में. ठीक है. And peripheral neuropathy में that is due to the deficiency of vitamin B6 or another name जिसको हम pyridoxine B कहते हैं. So you have to give pyridoxine alongside whenever you are giving isoniazid. ठीक है. Yes, ship drugs. Yes, ship drugs cause the SLE also. Very good. So ये CYP inhibitor होता है INH. It is not an inducer, it is a CYP inhibitor. Then next isoniazid, हम अभी next table में I'll show you. Also it is actually associated with psychosis. ठीक है, psychosis भी होता है associated, so that also is important. Pyrazinamide हमने बात किया. Pyrazinamide के दो major side effects हैं, which is hepatotoxicity and hyperuricemia. ठीक है. It is one of the most hepatotoxic drugs out of them, and it has a tendency to increase the uric acid. ठीक है. सो एक ओडी मूवी आई थी और जिसको वो प्यारी लगती है, सो पायराजिनामाइड यूरिक एसिड इंक्रीज करता है. सो दिस इज वन ड्रग एसोसिएटेड विद यूरिक एसिड, URI. And another important thing, this works well. It needs acidic pH for its working. Ethambutol का हमने किया जो mechanism here, that it inhibits the arabinogalactin synthesis here. And if you can pronounce ethambutol like ethambutol, EYE करके, so you know that it has the side effects, all the side effects associated with your eyes. So whether it is your retinopathy, optic neuropathy, or it is your red-green color blindness, ठीक है, ये दोनों चीज़ें ethambutol के साथ it is more prevalent. So these are some features or some points which are very very important. ये जितने भी highlighted हैं ये सारे questionable questions वाले, all the questions पूछे गए हैं. So you have to know all these points. ठीक है. Now let's get on to the fewer newer anti-TB drugs. ठीक है. So fewer newer anti-TB drugs के बारे में, the first one is bedaquiline, और इसके बारे में you should know how it works. So how it works, it inhibits the mycobacterial ATP synthase. ठीक है, inhibits the mycobacterial ATP synthase. This is important about this, it has been asked. Right? So अभी MCQ में भी पूछा गया था कि what are the correct options, उसमें ये एक option था. ADR इसका है, it can lead to QT prolongation. नथिंग मच टू और ज़्यादा इसके बारे में इतना इंपॉर्टेंट है दैट यू शुड नो. देन वी हैव डेलामेनिड. ठीक है, दूसरी एक न्यू ड्रग है डेलामेनिड. ऑल्सो इट इनहिबिट्स द माइकोलिक एसिड सिंथेसिस. ठीक है, माइकोलिक एसिड सिंथेसिस इनहिबिट करती है. एंड द ADR associated again is your QT prolongation. QT prolongation, right? The third one is pretomanid. Pretomanid, another new drug, and it has been approved. There is another therapy, it approved as a therapy for treating of pulmonary MDR और XTR tuberculosis के लिए. और जो रेजिम इसकी है, इसका नाम है B-PAL regime. B-PAL regime. उसमें जो B है, it stands for bedaquiline. P stands for pretomanid. और ये जो L है, it stands for linezolid. ठीक है, L stands for linezolid. तो ये regime है which has been approved for the treatment of pulmonary MDR as well as the XTR tuberculosis. और इसके ADRs हैं. One of the ADR is QT prolongation. It can cause bone marrow depression, bone marrow suppression, bone marrow depression also, and it can cause hepatotoxicity. ठीक है, so ये इसके important ADRs हैं. Then we have linezolid and sutazolid. Linezolid and sutazolid. Sutazolid is a congener of linezolid only, and they are going to inhibit the protein synthesis. We know that linezolid also inhibits the protein synthesis. ये कुछ newer anti-TB drugs है जिसके बारे में you can have these points that you should be knowing. Not in details, but these points. Right? Now, this is the table I am talking about, and इस table में important चीज़ें we will try to fill, and ये सारी चीज़ें only those questions which can differentiate between the different first line, मैं बात कर रही हूँ mostly the first line anti-TB drugs. What are the features or important things that is very very important or relevant for you to know. So let's start with the first point, nature of activity. How, if you compare the nature of activity of all these drugs, so you should know that all of them are cidal in nature except ethambutol. ठीक है, all are cidal in nature except ethambutol. Now where do they act? कौन से इंट्रासेलुलरली एक्ट करते हैं, कौन से एक्स्ट्रासेलुलरली एक्ट करते हैं. तो एक एक्सट्रीम जो पायराजिनामाइड है, इट एक्ट्स इंट्रासेलुलरली. दूसरा एक्सट्रीम स्ट्रेप्टोमाइसिन, मोस्ट इफेक्टिव ओनली एक्स्ट्रासेलुलरली, एंड ऑल द रेस्ट दे एक्ट ऑन बोथ इंट्रासेलुलर एज वेल एज द एक्स्ट्रासेलुलर ऑर्गेनिजम्स. ठीक है, सो इंट्रासेलुलर, extracellular, and you know the first line drugs you can remember with the mnemonic of Paris, PERIS. ठीक है, आईफल टावर याद रख लो और पेरिस की जगह पेरिस याद रखेंगे. ठीक है, now the most important side effects. Now this is very very important, most important side effects, और ये भी important है, ethambutol is the static drug. Most important side effects अभी हमने we have discussed. Now let's just repeat with the pyrazinamide. One, it is hepatotoxic. ठीक है, the one important side effect, it's one of the most hepatotoxic out of all these anti-TB drugs. ठीक है, then increases the uric acid. हमने कहा ओडी मूवी प्यारी लगती है, तो pyrazinamide uricostic increases the uric acid levels. The third important side effect associated with pyrazinamide is arthralgia. ठीक है, arthralgia. ये हो गया इंपॉर्टेंट. ये तीन इंपॉर्टेंट साइड इफेक्ट्स विद पायराजिनामाइड. ethambutol के बारे में अभी डिड लाइक ऑप्टिक और रेट्रोबल्बर न्यूराइटिस कॉज करता है, रेट्रोबल्बर न्यूराइटिस, एंड इसके लिए वी कैन गिव विटामिन B12 भी हम दे सकते हैं पेशेंट्स को लंग साइड. देन इट कॉजेस रेड ग्रीन कलर डिस्कलरेशन. ठीक है, रेड ग्रीन कलर डिस्क्रिमिनेशन में प्रॉब्लम आएगी, सो पेशेंट वोंट बी एबल टू डिस्क्रिमिनेट रेड ग्रीन कलर. ठीक है, सो एनी ड्रग विच कॉजेज ब्लू ग्रीन कलर डिस्क्रिमिनेशन में प्रॉब्लम, Any drug which you know which can cause blue-green color discrimination में problem? Blue-green. Any idea? Okay, so there is a drug sildenafil. Okay, sildenafil can cause blue-green color discrimination issue. Okay, so this is side effects for ethambutol. Coming to side effects for rifampicin. Rifampicin is another drug which causes hepatitis. It can also cause flu-like or respiratory syndrome, flu-like syndrome. Okay? And it can stain the contact lenses. You know, the secretions को stain करता है. And it can also stain, therefore, जो people who are wearing contact lenses वो भी stain रहते हैं. It stains the contact lens. This is about rifampicin. Isoniazid, INH वाला याद रखेंगे. So N stands for neuropathy, H stands for hepatotoxicity. I already told you neuropathy is more common in slow acetylators, hepatotoxicity is more common in fast acetylators. And another one you should know is psychosis, because ये भी पूछा गया एग्जाम में psychosis. ठीक है? Now isoniazid की जो you know that it causes peripheral neuropathy, so you have to give pyridoxine to the patient, vitamin B6 or pyridoxine. Now अगर dose के बारे में two important things to know. If you are giving prophylactically to the patient, ठीक है, if you are only giving prophylactically to the patient कि develop ना हो neuropathy, then your dose is 10 milligrams per day, ठीक है, for pyridoxine. But if you are giving for treatment, then your dose is 100 milligrams per day, ठीक है. So prophylactic dose is 10 and treatment के लिए dose is 100. So this is about the isoniazid. Then coming to streptomycin. Now streptomycin, it is an aminoglycoside. So aminoglycoside के सारे side effects होंगे because they're ototoxic, nephrotoxic, neurotoxic. So all these side effects are going to be there with streptomycin as such. Right. Yes, it can lead to sideroblastic anemia. Very good, Kishore. Yes, it can also lead to sideroblastic anemia. That is another important thing for INH to know. ठीक है. Now अब इनमें से हमने कर लिया. And now another इसमें से जो question एक I want to tell you is कि which of these drugs is safest is, or you can give it in liver failure. Liver failure में कौन सी drugs दोगे, दे सकते हो rather. Which of these, जितने भी हमने अभी बात की है, which of these drugs can be given in liver failure? Or they are safer in liver failure as compared to the others? जो hepatotoxic नहीं है, definitely they can be given in renal failures. So इसमें ethambutol, streptomycin, they can be given in the liver failure. ठीक है? Now, which of these drugs? Yes, ethambutol as well as streptomycin you can give. Both you can give. ठीक है? Streptomycin वैसे तो reserved ही drug है. We rarely prefer it. But अगर ये भी option में होएगा, अगर दोनों drugs option में होंगी, you can mark both. ठीक है? Then nephrotoxic drug कौन सी नहीं है, और let's say which of the drugs can be or they are safer in renal failure. Renal failure में कौन सी drugs दे सकते हैं? Renal failure. Renal failure में the safest, ठीक है, so remember out of these R, ठीक है, R, renal का R याद रखो. So rifampicin is the safest in renal failure. Isoniazid भी safe होता है, but safest की अगर बात करें, that is your rifampicin. Rifampicin is safest in renal failure. ठीक है. बस सेफेस्ट की अगर बात करें, बिकॉज दे विल आस्क यू, या सो सेफेस्ट की बात करें तो इट इज रिफैम्पिसिन. ठीक है, दैट इज दिस वन. सो दीज आर द इम्पॉर्टेंट. तो कौन सी यूज कर सकते हैं इन द रीनल फेलियर, कौन सी यूज कर सकते हैं इन द हेपाटिक फेलियर. कमिंग टू द एक्शन, व्हाट काइंड ऑफ एक्शन डू दे हैव. Pyrazinamide has the maximum sterilizing action. ठीक है, sterilizing action. Rifampicin is best for sprouters. ठीक है, sporadic growth, spurters, not sprouters, spurters, sorry, spurters, sporadic growth जो होती है. ठीक है, and inside, because it is inside the caseous material. And isoniazid is best for the rapidly multiplying ones. ठीक है, बेस्ट फॉर रैपिडली मल्टीप्लाइंग. सो स्पर्टर्स के लिए बेस्ट रिफैम्पिसिन, स्टेरिलाइजिंग एक्शन मैक्सिमम फॉर पायराजिनामाइड, एंड आइसोनाइजेड बेस्ट फॉर द रैपिडली ग्रोइंग वंस. ठीक है, सेफ्टी इन प्रेगनेंसी पहले हम करते हैं कौन सी अवॉइड करनी चाहिए. सो दिस शुड बी अवॉइडेड. ये तो एब्सोल्युटली नेवर टू बी गिवन, एंड ऑल द अदर्स आर सेफ. बट अगर सेफेस्ट की बात करें, सो आइसोनाइजेड इज द सेफेस्ट. ठीक है, तो द टू एक्सट्रीम्स शुड बी अवॉइडेड. पायराजिनामाइड, स्ट्रेप्टोमाइसिन, दोनों को अवॉइड करना है. रूट ऑफ एडमिनिस्ट्रेशन, ऑल ऑफ देम कैन बी गिवन ओरली एक्सेप्ट फॉर स्ट्रेप्टोमाइसिन IM. दैट्स फॉर इट इज नॉट अ वेरी प्रेफर्ड ड्रग, बिकॉज उसको इंजेक्टेबल फॉर्म में देना पड़ेगा बार बार. काइनेटिक्स में अगर हम बात करें, इंपॉर्टेंट यही है कि आइसोनाइजेड कैन क्रॉस द ब्लड ब्रेन बैरियर, एंड इसकी जो एसिटाइलेशन स्टेटस है, स्लो एंड फास्ट, ये दोनों चीज़ें इंपॉर्टेंट है. स्लो और फास्ट में क्या डिफरेंस है, प्लीज़, ये इंपॉर्टेंट चीज़ है इसके बारे में. सो ये कुछ इंपॉर्टेंट फीचर्स हैं, पॉइंट्स हैं विच हैव बीन आस्क्ड, एंड ये वाले मैक्सिमम जो हमने पॉइंट्स हैं इनके जो इंपॉर्टेंट है वो इसमें दोनों टेबल्स में कवर कर लिया. ठीक है, लेट्स गो टू द नेक्स्ट इज which are the extended first line drugs now. कौन कौन सी होती हैं extended first line drugs. एक तो हमारे पास स्ट्रेप्टोमाइसिन है, एक हमारे पास रिफाब्यूटिन है, और एक रिफापेंटिन है. ये तीन हैं योर extended first line drugs. ठीक है, extended first line drugs. ठीक है, now coming to some other features जो important पूछे गए एग्जाम में, the questions have been asked. In which drugs can cause in the anti-TB drugs में, which of the drugs can cause hypothyroidism? So can you tell me the drugs which have been linked with hypothyroidism in जो anti-TB drugs में? Hypothyroidism. Hypothyroidism. Very good here. Yes, so it is PAS and ethionamide. ये दो drugs हैं. This one, which is absolutely contraindicated in immunocompromised. नहीं दे सकते. Which is absolutely contraindicated in immunocompromised. You should not be giving thioacetazone. ठीक है, it causes very fatal hypersensitivity reactions. So don't give thioacetazone. Which of the drugs shows cross resistance to INH? अगर INH है और उसमें resistance, because INH is one of the most common drugs to cause जिसकी resistance develop हो जाती है. So which of the drugs has shown cross resistance to INH? Again, this is ethionamide. ठीक है, it is ethionamide. Yes, cross resistance ethionamide. So drugs which are useful in MAC. Drugs which are useful in MAC are EC. ठीक है, rifabutin, ethambutol, and clarithromycin, or you can use even azithromycin. Remember, INICET should never be used in MAC. It's not used in MAC rather. तो ये ड्रग्स हैं जो कि मैक में यूजफुल हैं. ठीक है, सो ये कुछ इंपॉर्टेंट हो गए और फीचर्स. Coming to the next question. So we've tried to rapidly cover all the important points of the anti-tubercular drugs. Let's go to the next topic isme through the question first. So it is a child of 14 years, presents with 4 lesions of leprosy on the back and 4 lesions on the arm. Treatment should be, which of the following treatments should be given to the child? कौन सा ट्रीटमेंट हम बच्चे में देंगे इनमें से? So now see, initially अगर ये question कुछ time पहले आता, so we would bother about finding out like whether it is a possibacillary or multibacillary because the treatment was different for both. So now currently क्या हो गया है कि possibacillary और multibacillary में जो number of drugs हैं they are the same, only the duration has changed. ठीक है, duration ही change हो गया है, so the number is not same, but still अगर आपको difference in any other form आता है तो one important thing is that जो possibacillary अगर आता है in the question you see the number of lesions. If it is till 5 it is a possibacillary case. If it is 6 or more than 6 then it is a multibacillary leprosy. ठीक है. Another important thing is this one, when there is no involvement of nerve or only one nerve is involved and along with the skin lesions. ठीक है, so that is your possibacillary. But multibacillary में if it is more than one nerve involved, so we don't care about the skin lesions. अगर more than one nerve involved है, so that means it's a multibacillary leprosy. So this is the important thing here. Now coming to the treatment, ठीक है, जो important चीज़ है. Now possibacillary, as I said, possibacillary or multibacillary treatment only is different. The duration is only different. The treatment remains the same now. So for rifampicin, ठीक है, the dose in the adults, yes, the dose in the adults is 600 milligrams, 600 milligrams once a month. 600 milligrams once a month, and every month the patient takes this drug and this is supervised under supervision. ठीक है. Now dapsone. Dapsone is 100 milligrams per day. But every day when you're taking the drug, it is not possible for supervision. ठीक है ना? So this is unsupervised. Third is clofazimine. Now clofazimine is taken in both forms. Supervised भी लेते हैं, unsupervised भी लेते हैं. तो supervised हमेशा once a month ही होगा. Every day is not possible. So it is 300 milligrams. So one day he takes 300 milligrams once a month. ठीक है? And that is supervised. उसके बाद he will take 50 milligrams per day and that is unsupervised. ठीक है? 50 milligrams per day unsupervised. So this is the regime which is followed for the adults and the duration is 6 months. In children, because children hai 10 to 14 years, the dose is less. So this rifampicin is 450. This is 50 half. ठीक है? And this is 150 once a month. Plus this remains the same 50 milligrams, but it is to be given every alternate day. So this is the regime in children now. ठीक है? So 450, 50 and 150 plus 50 in the children. Now in this case, if you see that dapsone is a static drug, clofazimine is also a static drug. So only sidal drug here is your rifampicin. So rifampicin is the most potent drug in leprosy, the sidal drug present out of these three. ठीक है? So rifampicin is there. Now, if you talk about the multibacillary here, जो multibacillary में, as I said, same है, ठीक है? सिर्फ the duration is changed to 12 months. So no confusion now. So it's easier to now remember, ठीक है, कि क्या हमने multibacillary में use करना है, क्या paucibacillary, सिर्फ the duration has to change. Now, important points to know now. So most effective or the potent drug here. So हमने बात की most effective and potent drug, अभी हमने बात की, it is your rifampicin. Rifampicin is there, ठीक है? The main side effect of clofazimine seen is the reddish black discoloration of skin and the body secretions. Reddish black discoloration of the skin and the body secretions. इसको कहते हैं ichthyosis. Very good, Kishore. Yes, ichthyosis. ठीक है, so reddish black discoloration that is seen with the clofazimine. Now, lepra reaction में what should be the treatment? The treatment is that you have to give, अगर पूछेंगे, that is your steroids. You have to start with steroids, which is your prednisolone, without stopping your drug for leprosy. जो anti-leprotic drugs को stop नहीं करेंगे, we are going to start with the prednisolone, and we start with 40 to 60 milligrams per day. So that's the first thing that we do. And in case persist कर रहा है, then you can add other drugs like, अगर persist कर रहा है, then you can add drugs like thalidomide, or you can give clofazimine. ठीक है? Yeah, and continue with the, yes, you have to continue, you do not have to stop. Now, dapsone, the things you should know important, एक static drug है. Secondly, it can cause hemolysis in G6PD deficient people. This is important about the anti-leprotic drugs. Itna information is more than enough for the anti-leprotic drugs. Coming to the third topic, which is your important, is the antiretroviral rather here. Now this is a chart, a diagram given, and you have to tell that which drug acts at the step 3, ठीक है, step 3 in the life cycle of a virus. Step 3, I'll just enlarge this a bit, and step 3 पे कौन act करता है? ये आपका step 1, this is step 2, this is step 3, this is step 4, this is step 5, and this is step 6, right? So out of these drugs, which of the drug is going to act at step number 3? 1. Very good, Arnav. It is raltegravir. Step number 3 है क्या? Integration. So आपको integrase inhibitors use करना है. So जिसकी spelling में T gray आ जाता है, ठीक है, T gray, that is your integrase inhibitors. So here your integrase inhibitors is raltegravir. So let's do here, N-furvitide acts at which step here? Can you tell me N-furvitide will act at what step? What does N-furvitide do? Because any drug can be asked, all the sites are important here. So they can ask you any drug, and same diagram में कोई और group drug डाल देंगे, and they will ask you to comment. 1, yeah, rather 1, N-furvitide acts at the fusion. It is a fusion inhibitor. ठीक है? fusion furvitide, and basically जो इसमें glycoprotein है, ठीक है? Yes, fusion inhibitor that you have to see. ठीक है? So that is important. अभी I will tell you about this also. 40 के बारे में, ठीक है? And how does it act? Then what about 3 and 4? What step does drug 3 and 4 act on? 3 and 4. स्टेप 4 रिवर्स ट्रांसक्रिप्टेज है, रिवर्स ट्रांसक्रिप्टेज इनहिबिटर्स. ध्यान से देखो, लेट मी दिस tenofovir zidovudine, what step? They are reverse transcriptase inhibitors. Reverse transcription कहाँ हो रही है? Reverse transcription. Yes, it is step number 2. ठीक है, so step number 2, they act on step number 2. ठीक है, so just be careful about this कि कहाँ पे act करे. Reverse transcriptase है. So ये again this is a, अच्छा ब्लड था, ओके ओके ठीक है. राइट, सो लेट्स सी, ये वाला एक डायग्राम है. दिस इज अगेन वेरी इंपॉर्टेंट डायग्राम एंड यहाँ पे सारे स्टेप्स हैं. इफ़ यू कैन मेक आउट ये वाले स्टेप्स आप देख लें. एंट्री, अगर अटैचमेंट की बात करें, विच इज़ द ड्रग विच एक्ट एट द पॉइंट ऑफ अटैचमेंट, इट इज़ योर मैरावायरॉक. ठीक है, मैरावायरॉक अटैचमेंट पे एक्ट करेगा. एनफर्विटाइड फ्यूजन या पेनिट्रेशन पे एक्ट करेगी. ठीक है, द नेक्स्ट स्टेप अनकोटिंग के बाद होता है रिवर्स ट्रांसक्रिप्टेज, रिवर्स ट्रांसक्रिप्शन विच अकर्स. ठीक है, सो डीएनए फ्रॉम आरएनए. सो वहाँ पे आपके NRTIs एंड NNRTIs एक्ट करेंगे. सो ऑल दीज ड्रग्स लाइक अबाकावीर, एमट्रोसिटाबीन, जीडोवुडीन, डाइडानोस्टीन, स्टैविडीन, एफाविरेंस, डेवेरापीन सारी एक्ट करती हैं. जो नेक्स्ट स्टेप होता है इंटीग्रेशन इनटू द होस्ट डीएनए और होस्ट जीनोम, और उसको कहते हैं इंटीग्रेज इनहिबिटर्स. सो टी ग्रे ऐसा है जहाँ पे टी ग्रे आता है, इसकी स्पेलिंग में दीज आर इंटीग्रेज इनहिबिटर्स. ठीक है, प्रोटीएज देन होता है स्टेप व्हेन द जब वायरस ये ट्रांसक्रिप्शन हो जाती है, देन देर इज ट्रांसलेशन एंड देर इज फॉर्मेशन ऑफ द न्यू, दे स्टार्ट असेंबली होनी शुरू हो जाती है. असेंबली के बाद they start budding and then it is the release. So protease is one of the enzyme which is required for this formation, for maturation के लिए काम आता है. So protease inhibitors are going to stop this process. And इसमें Navir, atazanavir and darunavir, Navir वाली drugs हैं, they usually come into this picture. ठीक है, there are even some newer drugs now which are your maturation inhibitors also. Maturation inhibitors भी आ गई हैं. ठीक है, बेविरीमैट करके एक है. ठीक है, so it is बेविरीमैट and Viviron. So these are some new names actually, you can remember Viviron and बेविरीमैट. ठीक है, so I'm going to tell you about each of these groups one by one, and after we discuss the next question, and then we'll just see the salient features of all of these drugs that are important for you to know. Yeah, बेविरीमैट and Viviron. ठीक है, दोनों. Now this question, right, can make out here. A patient of HIV is on combined ARTs, and after few months of treatment he develops pigmentation of the palms of the hand and soles of the feet. Which drug is most likely to cause this? Which drug was most likely to cause this? Very good. Yes, it is emtricitabine. So emtricitabine is associated with pigmentation of palms of the hand and the soles of the feet, and zidovudine, it causes pigmentation of the nails. That is the difference. ठीक है, so ये है. अगर पिक्चर फॉर्म में आता है क्वेश्चन, इन केस दे गिव यू अ पिक्चर एंड दे शो यू दिस पिगमेंटेड नेल्स आ रहे हैं यहाँ पे, एंड द ऑप्शंस ऑफ द ड्रग्स आर गिवन हियर. सो हियर यहाँ पे आप जीडोव्यूडीन लिख सकते हो. ठीक है, एंड हियर देयर इज पिगमेंटेशन. ठीक है, ये ब्राउन स्पॉट से हैं पिगमेंटेड, यहाँ पे भी पिगमेंटेड लीजन्स हैं, and this can be, this is because of the emtricitabine. ठीक है, ये आप ये if it is in the form of pictures. So यहाँ पे हमारा पास ऑप्शन था emtricitabine, and अगर ऐसा आता है pigmentation of the nails or they show you the picture, then you can mark this zidovudine. Now let's go to the important points about few of these drugs. So पहले हम करते हैं NRTIs. So best tolerated NRTIs out of the lot is your lamivudine and emtricitabine. Emtricitabine, lamivudine, one of the best tolerated NRTIs. ठीक है? The major side effect of zerovidine. Now, can you tell me the major side effect of zerovidine? So that is why it is contraindicated if your HP is already less than 9 या किसी को problems है. But HP less than 9 में हम नहीं देंगे zerovidine. Why? Because it causes. Why? So what is the major side effect of zerovidine? Myelosuppression. ठीक है? It can cause myelosuppression. And एक हमने yes bone marrow myelosuppression, very good किशोर. And the second अभी हमने discuss किया the nail hyperpigmentation का जो करता है, that is also another. But major side effect की बात करें तो that is your myelosuppression. Nail वाला is not the major side effect. Dose limiting side effect of diadenosine कौन सा होता है? Dose limiting side effect. Major side effect अलग है, but dose limiting है जिसके that with diadenosine. Major दूसरा है, but dose limiting. Dose limiting is pancreatitis. Major is your peripheral neuropathy, stocking and glove. ठीक है? That kind of peripheral neuropathy. But dose limiting is pancreatitis. Very good, Arnav. Yes. Major side effect with stavudine. Major side effect with stavudine. जिसकी वजह से we don't combine diadenosine with stavudine. ठीक है? हम ये दो combinations नहीं करते because of the reason. तो क्या चीज़ बढ़ जाएगी अगर दोनों देंगे साथ में? Peripheral neuropathy. So peripheral neuropathy is one of the side effects major which is seen with, yes Ardav, peripheral neuropathy is seen, even it causes lipodystrophy syndrome. But here is a major side effect, and therefore if it is given along with adenosine that gets aggravated. Major side effect with tenofovir is it is nephrotoxic. ठीक है? Nephrotoxicity है. So it is nephrotoxic drug. ठीक है? सो नॉन फेवरेबल कॉम्बिनेशंस ये हमने बात की. द फर्स्ट ये जो हमने स्टैवुडिन डायडानोसिन जो पूछा गया इंपॉर्टेंट, एंड आई बिकॉज ऑफ द पेरिफेरल न्यूरोपैथी दैट इज एग्रवेटेड. जीरोविडीन एंड स्टैवुडिन ऑल्सो दे आर नॉट प्रेफर टू बी गिवन टुगेदर बिकॉज ये फार्माकोलॉजिकली दे आपस में एक दूसरे को एंटागोनाइज कर देते हैं. ठीक है? सो दे फार्माकोलॉजिकली एंटागोनिज्म हो जाता है. सो देयरफॉर दे शुड नॉट बी गिवन टुगेदर. ठीक है? द मोस्ट टू इम्पॉर्टेंट वंस. देन कमिंग टू द अबैकावीर. अबैकावीर क्या क्या कॉज कर सकता है इंपॉर्टेंट जो इसके जो इश्यूज हैं. ए फॉर अबैकावीर, सो यू कैन से ए फॉर एलर्जिक रिएक्शंस वन. सो इट कैन कॉज हाइपर सेंसिटिविटी रिएक्शंस. हाइपर सेंसिटिविटी रिएक्शंस. ठीक है? हाइपर सेंसिटिविटी रिएक्शंस इट कैन कॉज, एंड इट इज अ ड्रग विच इज सेफर इन रीनल डिजीज. Safe in renal disease, right? Now, which drugs are used? Which drugs are used in HIV plus HPV? HIV plus HPV. Steven Johnson. Yes, hypersensitivity reactions. HIV plus HPV में कौन सी 3 ड्रग्स हैं जो कॉमनली यूज ओवरलैप हम कर सकते हैं? LET, निमोनिक है. LET. ठीक है? So L stands for lamivudine. E stands for emtricitabine. E stands for emtricitabine. T stands for tenofovir. ठीक है, again it has been asked. This also has been asked. Oh, one I left here, the upper, yes. The most common side effects of NRTI is here I left. It is actually the rashes. ये वाला I left. Rashes are the most common side effects. I'm not talking about toxic, most common. ठीक है, so LET हो गया यहाँ पे. And now coming to the first line, antiretroviral therapy. So ये important है. So कहीं पे भी the first line antiretroviral therapy रहेगी आपकी कौन सी? टीनोफोविर, लामिविडीन एंड इफाविरेंस. ठीक है, टीनोफोविर, लामिविडीन एंड एफाविरेंस इवन प्रेगनेंसी में. एंड सेकेंड वन, अगर बच्चा है चाइल्ड ऑफ 3 to 10 years, बिकॉज टीनोफोविर हैज़ नॉट बीन टेस्टेड सो वेल इन दी चिल्ड्रन एंड उसकी एफिकेसी एंड सेफ्टी इशूज ज़्यादा नहीं है, सो वहाँ पे वी रिप्लेस टीनोफोविर विद अबैकावीर. ठीक है, सो अबैकावीर हैज़ बीन रिप्लेस्ड. एंड अगर लेस देन 3 years का चाइल्ड है देन वी हैव अबैकावीर, लामिविडीन एंड अ बूस्टर PI रेजिम. ठीक है, प्रोटेज इनहिबिटर रेजिम, लोपेनावीर प्लस रिटोनावीर साथ में. It is not or, it is actually together. अभी हम देखेंगे ना why we are giving it together, so we give it together. So tenofovir, this is the adult therapy even if it is a pregnancy. Tenofovir, lamivudine, efavirenz. ठीक है, ये important हो गया इसके बारे में. Coming to the important point about the NNRTIs, अगर देखें specific toxicity of nevirapine. What is the specific toxicity of nevirapine? It can cause other toxicities also, but specific कोई toxicity है इसकी? Can cause hepatotoxicity. Okay, hepatotoxicity along with the rashes and all, that is also there, but the specific toxicity is the hepatotoxicity. Specific toxicity of efavirenz. Efavirenz is psychosis. And these are some newer drugs. ठीक है, NRTIs में all are virine, yes, fetal hepatotoxicity, right? Virine. ठीक है, so ये सारे न्यू ड्रग्स हैं, इट्राविरीन, रिलपिरीन एंड डोराविरीन. तो ये न्यूअर ड्रग्स हैं, दैट यू कैन जस्ट सी द नेम्स. यस, सो देयरफॉर अब ये है इसके 3 इंपॉर्टेंट पॉइंट्स अबाउट दीज ड्रग्स. ठीक है, नाउ कमिंग टू द प्रोटीएज एंड द इंटीग्रेज इनहिबिटर्स. प्रोटीएज एंड द इंटीग्रेज इनहिबिटर्स. सो रिमेंबर, जो प्रोटीएज में नाविर आते हैं और इंटीग्रेज में टीग्रेज हमारे ड्रग्स के नाम में आते हैं. So if we have to now talk about this, now most potent microsomal enzyme out of the protease की बात करते हैं. First, the most potent microsomal enzyme inhibitor of the CYP3A4, the most potent. Yeah, psychosis basically, that is said. ठीक है, CNS symptom, psychosis is caused. मोस्ट पोटेंट कौन सा है जो हम यूज करते हैं फॉर बूस्टर्स? एज अ बूस्टर इट इज योर रिटोनावीर. ठीक है, रिटोनावीर. सो दिस इज एक्चुअली, आई डोंट वांट टू स्ट्रेस ऑन दिस, ये मस्ट नो ही है, यू हैव टू नो दिस, रिटोनावीर. ठीक है, सो इसलिए उसको यूज करते हैं along with the other protease inhibitors because it increases their, it's a inhibitor, so it will increase their effects, right? So इसको लो डोज में यूज करते हैं 100 milligrams along with the other protease inhibitors, right? Ritonavir. Yes, Kishore. Now, which protease inhibitor का फायदा नहीं है if we combine it with ritonavir? So ritonavir has no effect with, किसके साथ नहीं इसको, which protease inhibitor cannot, there is no use combining that protease inhibitor with ritonavir. No effect with nelfinavir. ठीक है, इसके साथ there is no use combining ritonavir. Why? Because the cytochrome enzyme which metabolizes this is no, it has no effect with cobicistat. तो एक this it's an another CYP3A4 inhibitor. ठीक है, so I'm asking कि कौन से protease inhibitors के साथ there is no use combining ritonavir, that is nelfinavir. The reason is because the CYP जो इसको मेटाबोलाइज करता है, it is not 3A4, it is 2C19. Delfinavir. It gets metabolized by CYP2C19. So therefore ritonavir can do nothing with this. ठीक है. Least potent protease inhibitor. Least potent protease inhibitor is saquinavir. Least potent. Saquinavir is the least potent, and one of the side effects with this drug is it causes photosensitivity. ठीक है. Side effect which is seen with indinavir. Side effect which is seen with indinavir. Side effects which is seen with indinavir is it can cause crystalluria, and that can lead to kidney stones. Yes, nephrolithiasis, crystalluria, or it can lead to kidney stones or nephrolithiasis. That is one important side effect with indinavir. Intracranial hemorrhage is seen with which protease inhibitor? Tipranavir. ठीक है, tipranavir. Which protease inhibitor doesn't cause lipodystrophy syndrome? So all of them are usually associated with lipodystrophy syndrome because they're all metabolized in the liver and they can cause lipodystrophy syndrome. But which PI inhibitor has the minimal risk of causing the lipodystrophy syndrome? This is atazanavir. ठीक है, atazanavir. और ये जो tesamorelin है, it can be used in these cases because it is reducing the fat content. So tesamorelin is used. Very good. Yes, Kishore. Atazanavir. ठीक है. So इसमें the boosters, the new booster which has been approved, as you've already mentioned, for atazanavir, darunavir, and even eltegravir, use कर सकते हैं उसके साथ कई बारी. So that is your cobicistat. ठीक है, the latest approved is cobicistat. That can be used. So these are few important points about the protease and the integrase inhibitor. Now, important points to know about the entry inhibitors. Entry inhibitors के बारे में ये कुछ important points हैं, ठीक है? So these are the entry inhibitors, and entry inhibitors कहाँ कहाँ पे act करेंगे? ये सारे जो entry points हैं, whether it is your GP20 because it is important for attachment with the CD4. GP41, ठीक है, it is important for fusion. Then we have your CCR, ठीक है, chemokine receptor 5 and CXCR4, or we have CD4. So they're all involved in the first step, the entry inhibitors. ठीक है, कौन सी drugs are now there to block each of them? So the first drug हमने जो की थी पहले, that was your maraviroc. ठीक है, maraviroc binding to the CCR5. ये आपका maraviroc which binds to the CCR5. That's a fusion, binding to CCR5 attachment. The second is your binding to the GP120. So GP120, N-furvitide is with 41. ठीक है, N-furvitide is 41, जो CCR5, जो GP120 के लिए वी हैव अ मोनो, ये फॉस्टेमासाविर यहाँ पे जो है जी अटैचमेंट के लिए, लेट मी मेक इट हियर, सो दिस वन विल कम हियर GP120, ये अटैचमेंट के काम आता है CD4 के साथ हेलो करने से, एंड देन फ्यूजन होती है, पहले हेलो करते हैं एंड देन अटैचमेंट होती है एंड देन फ्यूजन होती है. सो दिस GP120 पे फॉस्टेमासाविर आ जाता है फॉर दिस वन. देन अब CD4 के अगेंस्ट भी एक मोनोक्लोनल एंटीबॉडी हमने बनाई विच इज फॉर इबालीजुमैब. ठीक है, इबालीजुमैब. देन जो हमने मेन जो अभी हमने किया था फ्यूजन इनहिबिटर, फ्यूजन इनहिबिटर FU आता है एनफोर्विटाइड की स्पेलिंग में, फ्यूजन इनहिबिटर, एंड 41 की भी 4 फ्यूजन एनफोर्विटाइड्स. रिमेंबर 41 पे बाइंड करता है, नॉट 120. So 4 fusion furvitide. So N-furvitide is important here and blocks this very step. And then there is a drug, new drug, which binds to both CCR2 as well as CCR5. And this is your Cenisrivirog. ठीक है, Cenisrivirog. के वाला. So these are the important entry inhibitors. इसके बारे में अगर पूछते हैं so you should know them. So यही हैं सारे entry inhibitors. So important to know which drug acts on what site, because ये बहुत सारे sites हैं यहाँ पे, तो कौन सी drug कौन के site पे act करती है, that is important to know. ठीक है, all right. So this was a quick rapid revision of the retroviral, antiretroviral drugs. Coming to the next one. Next question first, let's do. A patient from northeastern states was diagnosed to have infection with Plasmodium falciparum malaria. What is the most appropriate drug for this patient? Most appropriate drug for this patient. Very good, Arnav. This is your artemether and lumefantrine. Yes, Kishore, very good. It is artemether and lumefantrine. So artemisinin combination therapy use करते हैं हम. So artemisinin, lumefantrine. This is one which is even available as a fixed dose combinations. ठीक है. So let's get on with the important points in the anti-malarials. क्या क्या important चीज़ें इसमें पता होने चाहिए. Now which one is the fastest acting schizonticide? These are your artemisinins. और उसमें से भी fastest acting कौन सी है? Out of these artemisinins, it is your artesunate, fastest acting. Now because they have very short, they are very short acting, so they lead to faster recrudescence, because सारे it is not able to kill whatever the the sporozoites or those which are schizoans which are present there. So it causes faster recrudescence. That's why we have to combine artemisinins with the other drugs which are more longer acting. So they can cause, फटाफट से they will cause the they will lead to decrease in the number, or the load is decreased, but अगर only अगर हम इसको use करेंगे there will be a faster recrudescence again. Which artemisinin is developed in India? Which artemisinin is developed in India? Which artemisinin is developed in India? Artether. ठीक है, Artether is developed in India. So drug of choice next is for severe malaria. Whether it is cerebral malaria, they will give you the different presenting signs and symptoms, and it will be a severe cerebral malaria. So what is the drug of choice for cerebral malaria? Drug of choice for cerebral malaria क्या है? This is a life-threatening case, and so it's an emergency. So what will we give? We'll IV drug देंगे artesunate. ठीक है, IV artesunate is given. ठीक है, even pregnancy में अगर होता है, so we are going to give artesunates here. And in case there is an IV हमेशा. ठीक है, so drug of choice obviously emergency है, IV देंगे. And only resistant अगर कोई case है, then we are going to give quinine. Quinine हमने देते हैं, otherwise it is the drug of choice is IV artesunate. सो अनकॉम्प्लिकेटेड फैल्सीपेरम मलेरिया और क्लोरोक्विन रेजिस्टेंट वाइवैक्स. फैल्सीपेरम तो हम अज्यूम ही करते हैं इट इज रेजिस्टेंट, ठीक है ना. सो वहाँ पे हम क्या कर सकते हैं, वी यूज अ कॉम्बिनेशन विच इज योर artemisinin combination therapy and these are the various therapies. So north east में जो इसमें question आया था, only north east we use artemether plus lumefantrine. Everywhere else we are using artesunate plus sulfadoxine pyrimethamine. Everywhere else, this you should know, ठीक है. नॉर्थ ईस्ट में it is only artemether and lumefantrine and the other states we have artesunate plus sulfadoxine pyrimethamine combination, ठीक है. Now vivax malaria, which is the drug of choice here, what we use, and usually it is sensitive to chloroquine, so use chloroquine plus you will give primaquine, ठीक है. chloroquine primaquine for 14 days. So what is the role of primaquine here? Primaquine acts because vivax or falciparum, what is the difference? Which stage is not present? Yes, chloroquine along with primaquine. It is incomplete अगर आप सिर्फ chloroquine दोगे. You have to give primaquine alongside. And what is the reason of giving primaquine along with chloroquine? What is the reason of giving primaquine along with chloroquine? Yes. So one is a radical. So this is called as the radical cure. Complete cure, hypnozoid, and as well as the ये radical cure के लिए काम. This is called full complete cure. ठीक है. The term is radical cure. और वो hypnozoids also as well as the gametocidal दोनों चीजें करेगा. Hypnozoids as well as the gametozoids. Because vivax में you have the hypnozoid stage. Falciparum does not have the hypnozoid stage. So falciparum में that is the difference. Yes, relapse in vivax unavail to prevent. That is because of the hypnozoids. And chloroquine का जो important side effect याद रखना है, that is your bull's eye retinopathy जो कि पूछा गया है in the exam. Bull's eye retinopathy which is seen with chloroquine. Now malaria in pregnancy. So if it is a vivax malaria, what will you give? If it is a vivax malaria in pregnancy, then you will give chloroquine. ठीक है? Then you will give chloroquine. But if it is a falciparum malaria, then what is the difference? First trimester में क्या देंगे और second and third trimester में क्या देंगे? First trimester में क्या देंगे if it's a falciparum infection? Chloroquine, but falciparum में तो नहीं, because falciparum में resistance होती है. Vivax में definitely we are going to give chloroquine, yes. But what about falciparum? Yes, first trimester में very good enough quinine देंगे, and the second and third trimester में then second and third trimester area specific combination. So we use basically you can say artemisinin, ACT artemisinin combination therapies. Yes, first में quinine. So this is what you should know. Second में artemisinin combination therapy, but first में quinine, right? All right. Yes. Now suppressive prophylaxis, which is actually for travelers. ठीक है? Suppressive prophylaxis के लिए what drugs are to be given for suppressive prophylaxis? So these are for travelers who are traveling to endemic countries or regions जहाँ पे malaria है. So what drugs can you give? Suppressive prophylaxis. Yes, so if it is a less than 6 weeks stay, then you give doxycycline. Yes, more than 6 weeks, then you give mefloquine. But in case it's a child less than 8 years or in pregnancy, we cannot give doxycycline then. ठीक है, then we cannot give doxycycline. Contraindicated in children less than 8 years as well as in pregnancy. Then you have to go with mefloquine only. Because the reason is mefloquine is given actually just once a week. ठीक है, तो अगर लंबा स्टे है तो it is easier to take it once a week. But अगर डॉक्सीसाइक्लिन एवरी डे देना पड़ता है, सो इट्स अ मोर टीडियस थिंग, बट ऑब्वियसली अगर बच्चा है और प्रेगनेंसी में, देन वी कैन नॉट गिव दिस. Important side effect which is seen with mefloquine are your neuropsychiatric manifestations. Neuropsychiatric manifestations can be seen with mefloquine, and along अगर quinine और haloperidol साथ में देते हैं, then there is risk of QT prolongation. QT prolongation. So let's say G6PD deficiency है. Which is the safest drug in G6PD deficiency here? Safest in G6PD deficiency, it is your safe. कौन सी है? Mefloquine. Or the most notorious drug here, which can be a problem in G6PD deficiency, is your primaquine. So you will have to decrease the dose of primaquine in patients who are G6PD deficient. Now in transfusion, yes, mefloquine safe है. Transfusion induced malaria. So अगर blood के through malaria, जैसे किसी को blood चढ़ा है, उसके अंदर नहीं check हुआ properly, if the patient acquires malaria through transfusion, so here because सीधा वो already blood के अंदर है, so there is no hypnozoid state in these states. ठीक है? So आपको primaquine you can skip hypnozoid stage. You can skip the primaquine in this case. ये एक last में what I've written is Mosquirix. Any idea what is Mosquirix? What is Mosquirix? Yes, it is very nice. It is a vaccine, anti-malarial vaccine. So this anti-malarial vaccine is approved for children basically 6 week to 17 months. ये बच्चों में देते हैं. Yes, vaccine 6 week to 17 months में. And what it does कि ये antibodies produce करती है against these parasites. ठीक है? So basically अगर हम यहाँ पे बात करें, bite of a mosquito है, ये जो sporozoids release होते हैं. We have no drug currently जो कि ये sporozoids वाले stage को जो हमारे अंदर आ रहे हैं उनको tackle कर सके. ठीक है? So कि वो liver infect ना हो. So what this vaccine does, it creates antibodies against these. So therefore they are not going to go ahead and damage or affect the liver. ठीक है? So this is, but ये सिर्फ बच्चों में 6 weeks to 17 months. That is not in adults, not approved for the adults. ये बच्चों में दी गई, जहाँ पर endemic areas जहाँ पे बहुत common है मलेरिया, वहाँ पे. So ये एक वैक्सीन इसके लिए. बाकी यहाँ पे हमें पता है कि this is the liver stage और ये hypnozoid stage है यहाँ पे. So hypnozoid stage को हम treat करते हैं, we give radical cure. ठीक है? ये RBC की स्टेज है. So if you're giving the drug before the rupture of the RBC, then it is called as suppressive prophylaxis. ठीक है? Because you are suppressing it there. You're not allowing it to rupture because rupture is associated with fever, rigors and chills. And अगर वो हो गया है, then you are giving drugs which are for your clinical cure. ठीक है? So this is a radical cure. This is the suppressive prophylaxis. इसके ऊपर in the preclinical से we also have causal prophylaxis. So ये clinical cure है. और जब gametes form हो जाते हैं, अगर इसको कोई target करता है, then we have your gametocidal drugs. Again, primaquine is helpful here. So clinical cure के लिए we have so many drugs available, the fast and the slow acting drugs together. Except primaquine, mostly all the drugs can be used for the clinical cure, except for primaquine. Primaquine is majorly used for radical cure as well as a gametocidal and the causal prophylaxis, but not for the clinical cure as such. ठीक है? And this. So ये था. अगर आपको chloroquine के बारे में they ask you if it is a Vivax malaria, how do you give? So on day 1 you give 600 milligrams base, that is 4 tablets together. ठीक है? And this is actually your loading dose. And the reason for giving loading dose in chloroquine sensitive, this for chloroquine is because it has a very high volume of distribution, right? And then after 8 hours, you give 2 more tablets, 300 milligram base. Next day again 2 tablets, and then the third day again 2 tablets. And alongside you have to give for 14 days, Primaquine 15 milligram. So this will complete your Vivax का cure. ठीक है? So this is the chloroquine sensitive Plasmodium Vivax. And if it is only for falciparum में हम Primaquine single dose usually देते हैं, because that is just to take care of the gametocidal, because it doesn't have any hypnozoid stage. So only gametocidal effect चाहिए. So single dose can work there. ठीक है? So this is in a nutshell about the antimalarials. So coming to the last topic here, we have this question now. Which of the following is wrongly matched? Which of the following is wrongly matched? Yes. Which of the following is wrongly matched? It is your flu cytosine. Inhibition of microtubulars जो भी cause करते हैं mitosis पे, जो basically drugs usually हमारी act करती हैं, these are your griseofulvin. Flu cytosine inhibits the DNA synthesis and all. So ये एक this is the diagram. ठीक है? ये antifungals में से. So if you have to know what are the various sites of action, what are the ठीक है drugs acting on the various sites. Cell wall synthesis में you have your echinocandins. हमने बात की echinocandins की. ठीक है? अभी जो भी mechanisms है beta 1,3 glucan वाला. Then उसके बाद cell membrane integrity. It is seen by amphotericin B because it combines with the ergosterol, forms micropores, and उससे क्या होता है, धीरे धीरे सारा जो essential उसका material है अंदर से fungus के अंदर सारा बाहर निकल जाएगा. So that is the taking care of the integrity, membrane integrity को वो spoil कर देगा pores form करके. Nucleic acid synthesis के लिए flu cytosine. So here it works at the level of nucleic acid synthesis. Then azoles. Azoles जो होते हैं, they are basically involved in the inhibition of this step. Doesn't allow the formation of ergosterol from lanosterol. ठीक है? And ergosterol, you know, it's a very important component of the fungal cell wall. ठीक है? Then जो है terbinafine. Terbinafine क्या है? वो इसका एक step पहले inhibit करता है, squalene. It doesn't allow the formation of basically lanosterol. So lanosterol नहीं बनेगा तो आगे फिर obviously ergosterol नहीं बनेगा. ठीक है? So that you can route. उसके बाद अब हम करते हैं, these are the some important points that you should know. ठीक है? ये आप देख लो, important points इसमें हम highlight करते हैं. So antifungal जो पूछा, what is the important question जो आए हैं, that is a drug of choice for mucormycosis. ठीक है? And the other drug, the only azole which is responsible for mucormycosis, कौन सी है? Posaconazole. Posaconazole which is important for mucormycosis. ठीक है? ये दो important चीज़ें हैं, posaconazole के नाम for the mucormycosis. Then for cryptococcal meningitis, you need to start the therapy with amphotericin B, and then we continue the therapy with fluconazole. ठीक है? Then we continue the therapy with fluconazole. Or amphotericin B is also required for disseminated fungal infection. ये important चीज़ होगी amphotericin B. Then it is a very nephrotoxic drug. So how can you avoid this nephrotoxicity? You preload with sodium chloride. ठीक है? You preload with sodium chloride. And जो liposomal preparations है, they are also safe. Liposomal preparations are also safe. But they are very very expensive. इसलिए it is a क्या कहते हैं, one of the limiting feature is the cost. So hypokalemia is also seen with amphotericin B. So you might have to give potassium supplements to the patient because it causes hypokalemia. Coming to the azoles, the most very frequently used जो भी हैं antifungals, तो fluconazole drug of choice for candidiasis and cryptococcus. तो meningitis में ये सिर्फ initially use नहीं होते, it is only used later on. Itraconazole, another important drug which is a drug of choice for all these histoplasmosis, pityriasis versicolor, sporotrichosis, dermatophytes के लिए use होता है. देन वोरिकोनाजोल काफ़ी इंपॉर्टेंट रहा है बिकॉज ऑफ द मैनेजमेंट ऑफ इन्वेजिव एस्परजिलोसिस. ठीक है, इन्वेजिव एस्परजिलोसिस के लिए यूज़ करते हैं, एंड सर्टन रेजिस्टेंट इन्फेक्शंस एंड परसिस्टेंट फेब्राइल न्यूट्रोपीनिया. The important side effect you should know is phototoxicity and QT prolongation. ठीक है, persistent toxicity and QT prolongation. Posaconazole हमने बात की. This is one of the drugs which is effective, only azole effective against mucormycosis. ठीक है, mucormycosis. Terbinafine ज़्यादा यूज़ नहीं अब इसका रह गया, only local यूज़ रह गया है for the dermatophyte infections. ठीक है. Echinocandins also used for aspergillus and candida by IV infusion देना पड़ता है. And griseofulvin का again griseofulvin has very hardly much role now and only for dermatophytes के लिए use करते हैं, and reserved है especially for जो भी infection involving whole of the body. अगर local infection है तो हम localized treatment ही prefer करते हैं. Orally हम तभी देते हैं when there is resistance और बहुत ज़्यादा बॉडी सर्फेस इन्वॉल्व है. ग्रीजोफानल के बारे में दो चीज़ें इंपॉर्टेंट है. इट इज़ इसकी बायोअवेलेबिलिटी अब्जॉर्प्शन इज मोर व्हेन इट इज़ गिवन विद ग्रीजी फैटी फूड and that it causes a disulfiram like reaction. These two things are mostly important. Flucytosine ka, it is important with for chromoblastomycosis. ठीक है, chromoblastomycosis के लिए important है. ठीक है, एंड ये एक पेशेंट है, एक पिक्चर, द लास्ट पिक्चर यू सी, दिस इज पेशेंट इज प्रेजेंटिंग विद मल्टीपल हाइपर पिगमेंटेड स्केली पैचेस. ठीक है, विच हैड बिकम वाइड स्प्रेड अगर ऐसा पिक्चर आता है, एंड दे वर स्लाइटली इची. विच ऑफ द फॉलोइंग ड्रग्स विड यू प्रेफर फॉर दिस? ये बेसिकली जो पिक्चर है इट इज़ पिट्रियासिस वर्सिकोलर. ठीक है, सो हम प्रेफर करते हैं अगर वाइड स्प्रेड है, यस, इट्राकोनाजोल. यस, इट इज़ द ड्रग ऑफ चॉइस एक्चुअली. हम इट्राकोनाजोल इज़ द ड्रग ऑफ चॉइस फॉर दिस. सो दिस इज़ अ पिक्चर दैट यू गेट. यस किशोर, so this is that you should know about the itraconazole, and ये सारी जगह और कहाँ पे यूज़ हो सकती हैं, ये इसकी कंडीशंस हैं. ठीक है, वजाइनल कैंडिडियासिस में, डर्मेटोफाइट इन्फेक्शंस में, ऑनिकोमाइकोसिस, पिट्रियासिस वर्सिकोला ड्रग ऑफ चॉइस जो हमने ये बात की. ठीक है, सो ये क्लासिकल लीजन्स हैं पिट्रियासिस वर्सिकोलर के. तो ये आपको आना चाहिए इट्राकोनाजोल के बारे में. एक ये लास्ट में क्वेश्चन आया था, इसको ये रट्टा वाला क्वेश्चन बेसिकली, इफ यू कैन रिमेंबर, which of the following is correctly matched regarding the intrinsic resistance to antifungals? This was just recently asked in the last INICET paper. You can just remember this question by as such. ठीक है, कौन सा है इसमें important? Yes, 3. Very good. So this one is the correct option. So you can just remember it, ratify it, and know it. ठीक है, so with this we come to the end of this particular session. So there are few topics still left, but it's such a huge actually topic. So I've tried to cover the important points of antifungal हो गए हमारे, anti-malarial हो गए, antiretrovirals हो गए. ठीक है, इसमें anti-tubercular, anti-leprotic drugs. So we've tried to cover all of them together here. ठीक है, so next time what I'll do, हम specific topic नहीं लेंगे. So next time what I'll try to do is take a mixture of questions, again the previous year questions, and randomly we will go through all those questions, because topic wise already I've done, and now I'm going to randomly go through. ठीक है, different questions, and so that you know ये आपके जो brains के जो cells are, they can, because when you एक particular topic करना अलग बात है. So when you are asked exam में तो random questions आएंगे. So then how much you are able to recall the answers, that will give you more practice and more confidence alongside. ठीक है, so we will try to solve many questions. So we won't go in the details of each question, but we'll try to solve them, and one or two important points here and there we will try to revise about them. ठीक है, so Clostridium perfringens we can give penicillin, and otherwise there are drugs like you can give clindamycin, chloramphenicol, those kinds of drugs you can give. ठीक है. So all right now. So hope you have got some usefulness from there. ठीक है. यहाँ थोड़ा बहुत ये important whatever I could find to the best of my ability and capability. Time constraint ये है 1 hour में जितना हो सकता है. I've tried to cover the maximum which I could find. ठीक है. So take care guys and see you next time. Next time I'm going to take up more questions, as I said, mixed bag questions, and let's see how much we can solve randomly because exams are approaching. So all the best and see you in the next week. Thank you.